There's a quiet but really powerful transformation happening right at the heart of our healthcare system. And it's not what you might think. It's not some new gadget or a wonder drug. It's actually about a new kind of leader, one who's been there all along, but is now stepping up to become an architect of change. Today, we're diving into the rise of the nurse leader. And really, it all goes back to this foundational idea from the founder of modern nursing herself, Florence Nightingale. This quote is so key. It frames leadership not just as you doing your job well, but as you making sure the entire team can do their jobs well. And that idea, it's more critical right now than it has ever been.
So, what happened? Why did we suddenly need this new kind of leadership so urgently? Well, the story really kicks off at the turn of the 21st century, when a series of pretty shocking reports started sounding the alarm, revealing these deep, systemic flaws in American healthcare.
So between 2000 and 2010, the Institute of Medicine, the IOM, released these 4 massive reports, and they were absolute bombshells. To err as human, it exposed a staggering number of preventable deaths from medical errors. Then, Crossing the Quality Chasm came out and showed this huge gap between the care we could be giving and what people were actually getting. And that last one, The Future of Nursing, it had more internet hits than any other report the IOM had ever put out. People were really paying attention.
The message from all of this was just loud and clear. This wasn't about a few bad actors or a couple of hospitals having a bad year. The entire system was fundamentally broken. It was too expensive, it was often unsafe, and the quality of care was all over the map. Something big had to change.
But out of a crisis like that, sometimes a really powerful solution can emerge. The healthcare world started to realize it didn't just need better doctors or better nurses, it needed better architects. It needed leaders who could think in terms of entire systems, not just individual symptoms, and that led to a brand new kind of degree.
So meet the Doctor of Nursing Practice, or DNP. Now this was not just another academic credential to hang on the wall. This degree was specifically engineered to tackle the exact problems those IOM reports had uncovered. Its entire reason for being was to create this new generation of leaders who could redesign or re-engineer healthcare from the inside out.
That 2010 IOM report, The Future of Nursing, was really the final, unmistakable call to action. It laid out this super clear vision. Nurses, with their unique, patient-centered view, they had to be empowered. And that meant getting rid of barriers to their practice, pushing for higher education like the DNP, and most importantly, giving them a real seat at the table as full-on partners in redesigning the whole system.
Okay, so we've got this new kind of leader. But what's in their toolkit exactly? How do they actually go into a chaotic hospital or clinic and turn these big ideas into a new reality? Well, it all starts with changing the way people work together. Now, here's where things get really interesting. You'll hear the words interdisciplinary and interprofessional thrown around a lot, almost like they mean the same thing. But they don't, not at all. Interdisciplinary work is kind of like a relay race. Different experts just hand off their piece of the puzzle to get to the finish line. But interprofessional work? That's totally different. That's about learning with, from, and about each other to actually change how the entire team sees the problem in the first place.
And really what this all means is that just putting a doctor, a nurse, and a pharmacist in the same room doesn't magically create a team. Real, true collaboration only happens when they start to actually understand each other's perspectives and build a shared mindset that's all focused on one thing, the patient.
But look, even with an amazing team and a shared goal, change is hard, right? People naturally resist it. So how does a leader actually steer a team from the old way of doing things to a new, better way? Well, it turns out there's a roadmap for that.
This is it. It's called Lippitt's 7-Step Model for Change. Think of it like a clinical guide, but for changing an organization. So instead of just bursting in with a new idea, a smart leader uses this framework to first figure out what the real problem is. Then, to check if the team is even ready for a change, and only then do they start planning the steps. And check out those last 2 points. It's not just about starting the change, it's about making sure it actually sticks. This is how you turn a good idea into a lasting improvement.
Okay, so theories and frameworks are fantastic, but what does this new leadership actually look like on the ground? In the real world? How do these ideas translate into actual impact? Let's look at some stories from nurses who are out there doing it. I love this because leadership can start small. It can start by solving a very real, very practical problem. In this case, a nurse leader saw a need for herself and a colleague, and by solving it, she ended up creating this whole new, flexible system that helped the entire organization. That's leadership.
And this gets at the personal courage it takes. Leadership means stepping outside of what's comfortable and what's familiar. It's in that discomfort zone, where you might even fail, that the real growth and the real learning happens.
This quote just captures the sheer determination that's needed. For decades, the most important decisions in healthcare were being made without any nurses in the room. This new generation of leaders gets that you can't just wait for an invitation. You have to be proactive, you have to be assertive, and you have to demand that seat at the table. And that demand for a seat at the table? It's happening on a huge national scale. The Nurses on Boards Coalition set this incredibly audacious goal: 10,000 nurses on boards by the year 2020. This wasn't just for show. It was a strategic plan to get real clinical expertise and the patient's perspective into the highest levels of decision-making, where it belongs.
But you don't just magically land in a corporate boardroom overnight. The path to leadership is built one step at a time. It might start with something as simple as joining a committee at work, or leading your local PTA, or volunteering for a nonprofit. Every single one of those steps builds the skills, the confidence, and the network you need for the bigger roles down the line. Ultimately, it really all boils down to this. Leadership isn't about having some fancy title or knowing all the answers. At its very core, it just starts with showing up, raising your hand, and being willing to get involved.
And that leaves us with one final, really important question to think about. Right now, as we speak, in boardrooms and in government offices, decisions are being made that will directly affect your health and your family's health. So, who do you want at that table? A group of people who only know spreadsheets and profit margins, or a team that actually includes the people who know the patient experience best? The answer seems pretty clear, doesn't it?